Dear friends, welcome back to my YouTube channel. Today we are going to discuss about myopia, its types, causes and treatment in details. This is a part 2 of refractive error series, and those of you who haven't watched part 1, I would link that previous part in the description below. Okay, so let's get started. So what is myopia? The ametropic condition of the eye where the parallel rays of light after refraction falls in front of the retina instead of on the retina. Optics of the myopic eye. In a myopic eye, we see that it has a strong optical system for its axial length. What do you mean by strong optical system? We know about the lens and cornea, they have a specific curvature, but in myopic patients, what happens is this curvature is greater. So due to which there's more convergence and the image is formed in front of the retina. And now this image that is formed in front of the retina, what happens is the divergent rays from here, they form circle of diffusion on the retina, due to which the image that is formed is blurred. Second thing that you need to know is that for myopic patient, the far point is at finite distance from the eye and not at infinity, that is 6 meters, which means two things. Firstly, that there will be difficulty in viewing objects beyond this point, that is why poor distance vision complain. Secondly, now since the far point is near, so the eye does not need to accommodate to see near objects as well. So accommodation is not normally developed. The other things that you need to know is that the nodal point is further away from the retina, due to which the image is larger than the emmetropic eye and spectacle corrected eye. Moving on to the types, we can broadly classify them as etiological types and clinical types. So under etiological types, they are axial myopia, curvature myopia, positional myopia, index myopia, and pseudomyopia. Axial myopia is associated with increase in axial length. Curvature, increased curvature of cornea, lens, or both. Positional myopia, anterior placement of the lens. Index myopia, increase in refractive index. And pseudomyopia is due to excessive accommodation and spasm of accommodation. The clinical types are simple myopia, pathological myopia, congenital myopia, and acquired myopia. I'm going to discuss each of them in the next slides. Simple myopia. This is also known as physiological myopia as it results from normal biological variations in the eye. The variations are increase in axial length and increase in curvature. The other causes of simple myopia are genetics and excessive near work. Okay, so regarding genetics, a child whose both the parents are myopic has 20% more chance of being myopic as compared to the one with one parent myopic, that is 10%, or non-parent myopic, that is 5%. So the age of onset is 7 to 10 years. This is also the school-going age. That is why this is also known as school myopia, which automatically stabilizes at adolescence at about -5 to -6 diopter. The symptoms are poor distance vision, half closing of eyes, asthenopic symptoms, and more interest in indoor activities. I hope you know the difference between symptoms and signs. Symptoms are the ones that the patient complains, and signs what we find during the evaluation. Okay? So getting on with the signs, they are prominent eyeballs, large pupils, sluggish reaction to light, ACE depth is deep, normal fundus, and rarely you can see temporal myopic crescent, and the magnitude of error is not more than 6 to 7 diopter. The diagnosis is made during the routine eye examination that includes everything: visual acuity, retinoscopy, ophthalmoscopy, etc. Okay, and prognosis for simple myopia is poor in unilateral cases if anisometropia and myopia are severe. Otherwise, the prognosis is good. Pathological myopia is degenerative and progressive. Magnitude of error is high. High means greater than 6 diopter. So it starts at childhood and increases up to early adult years. Magnitude of error is progressive and it progresses really quickly. almost 4 diopter yearly, and finally amounts to 15 to 20 diopter or more. This varies from person to person. Etiology is heredity and poor general health. That includes nutritional deficiencies, debilitating diseases, endocrinal disturbances, etc. The symptoms are poor distance vision, next musky volitants. They are also known as floaters. Patients can complain of black spots, threads, cobweb-like structures. Okay, all of these fall under pathological myopia. Also, there are complaints of night blindness and omission of words while reading. Okay, the signs are prominent eyeballs, large cornea, deep AC depth, pupils are large and sluggish reaction, magnitude is of course greater than 6 diopter. The ophthalmoscopic findings are the optic disc is large and pale. You can see myopic crescent, chorioretinal myopic degeneration in the central area, posterior staphyloma, and degenerative changes in vitreous body as well. Okay. So in the next slides, you can see the pictures of the fundus. Other signs that we can see are contraction in the visual fields. Okay. And electroretinography reveals subnormal electroretinogram. Complications related to pathological myopia are retinal tears, retinal detachment, nuclear sclerosis, vitreous hemorrhage, choroidal hemorrhage, primary open angle glaucoma, and complicated cataract. So, congenital myopia. So, as the name suggests, it is by birth, okay? And it is associated with increase in axial length or the overall globe. More frequent in premature children or with various birth defects. And it is diagnosed by 2 to 3 years of age. So, the clinical factors are high degree of error, that is 8 to 10 diopter, which remains constant. It is usually unilateral, due to which anisometropia happens, and this may also be associated with other congenital abnormalities. Okay, so how does congenital myopia get diagnosed? So for unilateral myopia, it gets diagnosed during routine exam or after strabismus has been developed, or like accidentally when the baby is playing and you suddenly try to close one eye of the baby and he suddenly starts to cry or tries to remove it. So in this way you can diagnose unilateral myopia. And bilateral myopia, the infant tends to hold the things closely. So this gives you an idea that the kid might be having bilateral congenital myopia. Okay, so the last type is acquired myopia. So these are secondary and produced due to other conditions. And these are also similar to the simple myopia. Okay, so the types are index, caused due to nuclear sclerosis, incipient cataract, diabetic myopia, etc. Then the next is curvaitural, caused due to keratoconus or lenticonus. Next is positional, caused due to anterior subluxation. Consecutive myopia, caused due to pseudophakia with overcorrection. And next, pseudomyopia, caused due to excessive accommodation. Nocturnal myopia, caused due to excessive accommodation induced by low contrast and dim illumination. Space myopia caused as there is no distance fixation, so the eye tends to choose a near fixation point. Okay, so due to which space myopia is developed. And drug-induced myopia caused due to certain drugs. Treatment for myopia. The first optical treatment is concave lenses, that is minimum minus lens. Okay, and the patient should be asked to use it properly for as far as possible. Full correction should be given in simple myopia from 3 years and above to 30 years. Beyond that, you can undercorrect, as patients older than 30 years are not able to tolerate a full correction over 3 diopter if they have never worn glasses before. For high myopia, undercorrection should be given according to their acceptance to avoid problem of near vision and magnification of images. And you should also advise to use a weaker near glass, and even they should constantly glasses as it's impossible for them to converge for the near work. Okay. Next is contact lens. Contact lens have an advantage of providing wider field and larger image size as compared to the glasses in patients with higher myopia. Next is surgeries. Surgeries for patients who do not want to wear spectacle and are intolerant of contact lens. The most popular surgery being LASIK. That is for people above 21 years and those with stable refractive error. The other options for surgery are clear lens extraction and implantation of intraocular contact lens within the posterior chamber or in the anterior chamber. Okay, now the preventive measures. We can use atropine or orthokeratology for slowing down the progression of high myopia. High myopia patients should also have proper nutrition, and the other preventive measure is that both the myopic parents should go for genetic counseling. Next is maintenance of visual hygiene, which includes sitting in proper posture and in adequate illumination. Next is low vision aids. So for patients with advanced degenerative changes where useful vision is not obtained with spectacles and contact lens, they should go for LVA. Okay, so that's it for the treatment of myopia. That's it for today. Thank you so much for being with me. Please like, share and subscribe my YouTube channel for more such videos, and also follow my Facebook page, Optometry Educational Videos.